In the context of pain management for a terminally ill patient, what are the key principles a nursing assistant should follow to ensure effective care? Provide specific strategies and considerations that should be applied when managing pain in patients at the end of life. Answer: pain management for terminally ill patients is a critical aspect of end-of-life care. The key principles include assessment, conduct a thorough assessment using verbal and nonverbal cues to understand the patient's pain level. Use tools such as the Numeric Rating Scale (RS) or Wong-Baker FACS Pain Rating Scale, especially for patients who may have difficulty communicating. Individualized care. Recognize that pain is subjective and therefore treatment should be tailored to the individual. Factors such as cultural background, previous experiences with pain, and personal beliefs about pain management should inform the care plan. Interdisciplinary collaboration. Work closely with the healthcare team, including nurses, physicians, and pharmacists, to develop an effective pain management strategy. This may include pharmacological interventions, e.g., opioids, non-opioids, adjuvants, and non-pharmacological methods, e.g., massage heat application, monitoring and reassessment. Regularly monitor the effectiveness of pain management interventions and reassess the patient's pain level. Adjust the care plan as needed based on the patient's response and any changes in condition. Education and communication. Educate patients and families about pain management options and involve them in discussions regarding treatment preferences, ensuring that they understand the benefits and potential side effects of medications. Relevant guidelines. The National Comprehensive Cancer Network (NCCN) provides guidelines for pain management in patients with cancer, which emphasizes a multidisciplinary approach and ongoing evaluation. What are the key physical and emotional changes a nursing assistant should expect to observe in a patient who is nearing death? How should these changes guide the assistant's care approach? Answer: as patients near death, nursing assistants should recognize both physical and emotional changes, including physical changes, decreased vital signs, heart rate may become irregular and blood pressure may drop. Respiratory patterns may also change, often becoming shallow or labored. Skin changes. Patients may experience mottling of the skin, particularly on the extremities, and a cooling of the body as circulation diminishes, loss of appetite and thirst. Patients may refuse food and fluids, indicating a natural decline in bodily needs. Altered breathing patterns. Cheyne-Stokes respiration, characterized by periods of deep, rapid breathing followed by periods of apnea, may occur. Emotional changes. Withdrawal. Patients may become less communicative, preferring to be alone or engaging less with loved ones. Increased fatigue. A noticeable decrease in energy levels and responsiveness may be observed, often leading to prolonged periods of sleep. Fear or anxiety. Patients may express fears about dying or the unknown, necessitating emotional support. Care approach. Provide a calming environment and ensure comfort measures are in place, such as positioning, pain management, and emotional support. Offer reassurance and be present for the patient and their family, allowing for conversations about fears, wishes, and final arrangements. Relevant guidelines. The End-of-Life Nursing Education Consortium (ELNEC) outlines essential nursing care at the end of life, emphasizing comfort, support, and open communication. A nursing assistant is responsible for post-mortem care of a patient who has just passed away. What steps should the assistant take to prepare the body for family viewing? Include any relevant policies or ethical considerations. Answer: post-mortem care involves several important steps to respect the deceased and support the family. Assessment and documentation. Confirm the patient's death with appropriate protocols, documenting the time of death and any relevant observations. Preparation of the body. Positioning. Gently position the body in a supine position with arms at the sides or folded across the abdomen to promote dignity. Cleaning. Wash the body with a damp cloth, ensuring to remove any secretions or debris. This helps to present the body in a respectful manner. Identification. Ensure identification tags are placed on the body, adhering to facility protocols to avoid confusion during transportation. Family viewing preparation. Environment. Dim the lights and create a peaceful atmosphere if possible by closing curtains or doors. Covering. Use a clean sheet or blanket to cover the body, exposing only the face if that is the family's wish. This can help create a more serene environment for family members. Emotional support. Offer support to the family as they prepare to say goodbye. Provide tissues and a private space for them to grieve. Ethical considerations. Respect the cultural and religious beliefs of the deceased and their family regarding post-mortem care. Communicate openly with family members about the process and address any questions or concerns they may have. Relevant policies. Facilities often have specific post-mortem care policies, including protocols for handling the body and family interactions, which nursing assistants must follow to ensure compliance and respect for the deceased. Describe effective communication strategies that nursing assistants should employ when discussing end-of-life care options with patients and their families. How can these strategies facilitate better decision-making? Answer: effective communication in end-of-life care is crucial for ensuring that patients and families feel informed and supported. Key strategies include active listening. Demonstrate empathy and understanding by listening attentively to the concerns and preferences of patients and their families. Reflect back what they say to validate their feelings. Use of clear, simple language. Avoid medical jargon and explain concepts in straightforward terms. Ensure that patients and families understand the information being provided. Encourage questions. Create an open environment where patients and families feel comfortable asking questions. This can help clarify doubts and promote informed decision-making. Provide information about options. Discuss available treatment options, including palliative care and hospice services, emphasizing their benefits and potential impacts on quality of life. Involve interdisciplinary team members. Include other healthcare professionals, such as social workers or chaplains, in discussions to address emotional, spiritual, and practical concerns. Documentation of wishes. Encourage families to document their preferences regarding care and treatment, ensuring that the patient's wishes are respected and communicated to all members of the care team. Relevant guidelines. The National Hospice and Palliative Care Organization (APO) outlines best practices for communication in palliative care settings, highlighting the importance of clarity, empathy, and shared decision-making. Mrs. Thompson is a 78-year-old patient diagnosed with terminal cancer. She is currently receiving palliative care at home but expresses a desire to stay comfortable without invasive treatments. Her family, however, insists on trying every possible treatment to prolong her life. What steps should the nursing assistant take to navigate this situation and support Mrs. Thompson's wishes? Answer: in this scenario, the nursing assistant should take several steps to navigate the conflicting wishes between Mrs. Thompson and her family while ensuring that her preferences are prioritized. Assess Mrs. Thompson's wishes. Engage in a compassionate conversation with Mrs. Thompson to clarify her desires regarding her care. Document her preferences carefully. Facilitate family communication. Organize a family meeting to discuss Mrs. Thompson's condition and her stated wishes. Ensure that Mrs. Thompson is present if she feels comfortable, allowing her to express her preferences directly. Educate the family. Provide information on palliative care and its focus on comfort rather than curative treatments. Explain the benefits of honoring Mrs. Thompson's wishes and the potential impact of aggressive treatments on her quality of life. Involve healthcare professionals. If the family remains resistant, involve a social worker or palliative care specialist who can provide additional support and education. They can address the family's concerns and help them understand the importance of respecting Mrs. Thompson's autonomy. Document and communicate. Ensure that Mrs. Thompson's care preferences are documented in her medical record and communicated to all members of the healthcare team, including any changes that occurred during discussions with her family. Relevant guidelines. The American Academy of Hospice and Palliative Medicine emphasizes the importance of patient-centered care, advocating for the involvement of patients in decision-making regarding their treatment. What role does a nursing assistant play in supporting families who are grieving the loss of a loved one? Discuss specific strategies that can help facilitate this process. Answer: nursing assistants play a vital role in providing support to grieving families. Key strategies include active listening. Offer a compassionate ear for family members to express their feelings. Allow them to share their stories and memories, validating their emotions. Provide comfort measures. Help create a supportive environment by providing physical comfort, such as offering blankets, tissues, and refreshments, and ensuring privacy during times of mourning. Encourage expression of feelings. Encourage family members to share their grief and emotions openly. This may involve discussing their loved one's life, sharing memories, or expressing sadness. Referral to support services. Inform families about grief support services available in the community, such as counseling or support groups that can help them process the loss. Follow-up care. If possible, follow up with families after the loss to check on their well-being and offer continued support, reinforcing that they are not alone in their grieving process. Discuss the ethical dilemmas that may arise when providing end-of-life care. What frameworks or principles should nursing assistants consider when faced with these dilemmas? Answer: end-of-life care often presents ethical dilemmas that require careful consideration. Key dilemmas may include autonomy versus beneficence. balancing respect for the patient's autonomy, their right to make decisions about their care, with the principle of beneficence acting in the best interest of the patient. Nursing assistants should advocate for the patient's wishes while also considering their overall well-being. Informed consent, ensuring that patients and families are fully informed about treatment options and potential outcomes, is crucial. This includes discussing risks and benefits clearly and honestly. Resource allocation. In situations of limited resources, ethical dilemmas may arise regarding the allocation of care. Nursing assistants should support equitable access to care for all patients while respecting the needs of the individual. Cultural sensitivity. Ethical dilemmas may stem from cultural differences in attitudes toward death and dying. Nursing assistants should be aware of these differences and incorporate culturally sensitive practices into their care. Frameworks for consideration. Principlism. This framework considers 4 key principles: autonomy, beneficence, non-maleficence, do no harm, and justice. Nursing assistants can apply these principles to guide their ethical decision-making. Ethical committees. Many healthcare facilities have ethics committees that can provide guidance and support in resolving complex ethical issues related to patient care. Relevant guidelines. The American Nurses Association on a Code of Ethics for Nurses offers foundational principles for ethical nursing practice, emphasizing the importance of patient-centered care and advocacy. What are the primary responsibilities of a nursing assistant when providing palliative care to patients? Discuss how these responsibilities differ from those in acute care settings. Answer: in palliative care, nursing assistants have specific responsibilities that focus on enhancing the quality of life for patients with life-limiting conditions. Key responsibilities include personal care assistance. Nursing assistants help patients with activities of daily living, adults including bathing, dressing, grooming, and toileting, ensuring comfort and dignity. Pain and symptom management. Assist in managing pain and other distressing symptoms by implementing comfort measures such as repositioning, applying heat or cold, and reporting any changes in the patient's condition to the nursing team. Emotional support. Provide emotional support to patients and their families, listening to their concerns and fears and facilitating open communication with healthcare professionals. Collaboration with the healthcare team. Work closely with nurses and other healthcare providers to develop and implement individualized care plans, focusing on the patient's goals and preferences. Cultural competence. Be sensitive to the cultural, spiritual, and personal values of patients and families, incorporating these considerations into care practices. Differences from acute care settings. In palliative care, the focus is on quality of life and symptom relief rather than curative treatments. In acute care settings, the emphasis is on diagnosis and treatment of medical conditions. Palliative care often involves long-term relationships with patients and families, while acute care may involve more transient patient interactions. Relevant guidelines. The National Consensus Project for Quality Palliative Care provides guidelines for palliative care practice, emphasizing patient-centered approaches and the importance of interdisciplinary collaboration. How can nursing assistants effectively manage patient comfort in a palliative care setting? Discuss both physical and emotional strategies that can be employed. Answer: managing patient comfort in palliative care involves a holistic approach that addresses both physical and emotional needs. Key strategies include physical comfort, pain relief. Administer prescribed pain management interventions as directed and monitor their effectiveness. Report any concerns regarding pain to the nursing staff promptly. Positioning. Regularly reposition patients to prevent pressure ulcers and enhance comfort. Use pillows and supports to maintain a comfortable position. Environmental modifications. Adjust the room temperature, lighting, and noise levels to create a serene environment conducive to relaxation. Emotional comfort. Presence and availability. Offer calm and reassuring presence. Be available for conversations, allowing patients to express their fears and concerns without judgment. Facilitating family involvement. Encourage family members to participate in care, which can provide emotional support to the patient and foster a sense of normalcy. Meaningful activities. Engage patients in activities that bring them joy or comfort, such as reading, listening to music, or reminiscing about positive memories. Discuss the ethical and legal responsibilities of nursing assistants when caring for terminally ill patients. What guidelines should they follow to ensure compliance with relevant laws and ethical standards? Answer: nursing assistants have both ethical and legal responsibilities when providing care to terminally ill patients, including respect for patient autonomy. Nursing assistants must respect the patient's right to make decisions about their care, including the right to refuse treatment. This requires clear communication and documentation of the patient's wishes. Confidentiality. Upholding patient confidentiality is crucial. Nursing assistants must safeguard sensitive information and only share details with authorized personnel. Informed consent. While nursing assistants may not obtain informed consent themselves, they play a role in ensuring that patients are adequately informed about their care options and that their choices are honored. Reporting and documentation. Accurate documentation of care provided and any changes in the patient's condition is vital. Nursing assistants must report significant findings to the nursing staff promptly. Understanding scope of practice. Nursing assistants must be aware of their scope of practice and avoid performing tasks outside their training and competencies. This includes being knowledgeable about facility policies and state regulations governing nursing assistant practice. Relevant guidelines. The National Council of State Boards of Nursing (SEN) provides a framework for nursing practice that emphasizes the importance of ethical conduct and adherence to legal standards in healthcare. How should a nursing assistant approach a patient experiencing anxiety due to an upcoming medical procedure? Answer: to effectively support a patient experiencing anxiety, the nursing assistant now should first recognize the signs of anxiety, which may include restlessness, rapid breathing, or verbal expressions of fear. The NA should engage in therapeutic communication by actively listening and validating the patient's feelings. Relevant guidelines. Establish trust, use open body language, and maintain eye contact to create a comfortable environment. Provide information, explain the procedure in simple terms to help demystify it and alleviate fears. Encourage questions, allow the patient to ask questions and express concerns. Relaxation techniques. Teach and guide the patient through relaxation techniques such as deep breathing or visualization. Consult with healthcare team. If anxiety persists, inform the supervising nurse for potential referral to a mental health professional. In what ways can ACNA promote patient dignity and independence, especially in patients with physical disabilities? Answer: promoting dignity and independence in patients with physical disabilities involves a multifaceted approach that respects their autonomy and individual preferences. Key strategies: encourage self-care. Whenever possible, allow patients to perform activities of daily living adults independently or with minimal assistance. For example, offer adaptive equipment such as grab bars or long-handled sponges for bathing. Involve patients in decision-making. Engage patients in discussions about their care plans, respecting their choices regarding treatment and personal care. Maintain privacy. Ensure privacy during personal care tasks to foster respect and dignity. Acknowledge achievements. Celebrate small milestones in their independence, reinforcing their self-esteem. Relevant guidelines. The American Nurses Association honor emphasizes the importance of respecting patient autonomy and promoting self-management as part of person-centered care. Mr. Thompson is a patient exhibiting signs of agitation and verbal aggression towards staff. What steps should the CNA take to de-escalate this situation? Answer: when dealing with Mr. Thompson's agitation, the CNA should employ de-escalation techniques to ensure the safety of both the patient and staff. Steps to de-escalate: stay calm, maintain a composed demeanor to avoid escalating the situation further. Use active listening, acknowledge Mr. Thompson's feelings without judgment and allow him to express his frustrations. Provide space, ensure a safe distance between the CNA and Mr. Thompson to prevent perceived threats. Offer choices. Empower Mr. Thompson by providing options regarding his care, which may help regain his sense of control. Seek assistance. If the situation does not improve, involve additional staff or notify a supervisor for further intervention. Relevant guidelines. The Joint Commission highlights the importance of training staff in de-escalation techniques to handle potential aggression effectively. Describe the techniques a CNA can use to improve communication with cognitively impaired patients. Answer: communicating effectively with cognitively impaired patients requires patience, adaptability, and specific strategies tailored to their needs. Techniques include simple language, use clear, straightforward language and short sentences to convey information. Nonverbal cues, rely on gestures, facial expressions, and visual aids to reinforce understanding. Repetition and consistency. Repeat important information and maintain consistency in caregivers to provide a sense of security. Redirect attention. If the patient becomes frustrated, gently redirect their focus to a different topic or activity they enjoy. Validate feelings. Acknowledge the patient's emotions and concerns even if their understanding of the situation is limited. Relevant guidelines. The Alzheimer's Association suggests that caregivers use positive reinforcement and validation to improve communication outcomes with patients suffering from cognitive impairments. A patient has recently experienced the loss of a loved one and is showing signs of grief. What should the CNA do to support the patient through this difficult time? Answer. Supporting a patient who is grieving involves sensitivity and understanding of the emotional and psychological impacts of loss, supportive actions. Listen actively. Provide a safe space for the patient to express their feelings without interruption or judgment. Acknowledge grief. Validate the patient's feelings by acknowledging that grief is a normal response to loss. Provide comfort. Offer comforting gestures, such as a warm blanket or a quiet space, to help the patient feel safe and supported. Encourage expression. Encourage the patient to share memories or feelings about their loved one, which can facilitate healing. Refer to mental health services. If grief significantly affects the patient's daily functioning, notify the healthcare team for further assessment and possible referral to counseling services. How can a CNA handle cultural sensitivity when providing care to patients from diverse backgrounds? Answer. Cultural sensitivity is critical in providing effective care to patients from diverse backgrounds. CNAs should recognize and respect cultural differences and preferences. Key practices: cultural awareness. Educate oneself about various cultural practices and beliefs, particularly those related to health and illness. Communication. Use interpreters when language barriers exist, ensuring effective communication. Respect dietary preferences. Be aware of and accommodate cultural dietary restrictions during meal planning. Incorporate family. Involve family members in care decisions, as many cultures place a strong emphasis on family involvement in healthcare. Relevant guidelines. The Office of Minority Health emphasizes the importance of culturally competent care in reducing health disparities and improving patient outcomes. Mrs. Jones is an elderly patient diagnosed with early-stage dementia. She frequently becomes confused and refuses to participate in her daily care routines. What strategies should the CNA implement to encourage Mrs. Jones's participation while maintaining her dignity? Answer. In managing Mrs. Jones's confusion and reluctance to participate in care, the CNA can implement several strategies to encourage participation while preserving her dignity. Strategies include routine establishment. Develop a consistent daily routine that Mrs. Jones can anticipate, which helps reduce confusion and anxiety. Choice empowerment. Offer Mrs. Jones choices regarding her care activities, e.g., would you like to brush your teeth before or after breakfast? To empower her decision-making. Familiarization. Use familiar objects or reminders from her past, like photographs, to stimulate her memory and create a comforting environment. Positive reinforcement. Praise her participation in any activity, reinforcing her self-esteem and willingness to engage. Involve family. Encourage family involvement to provide additional support and familiarity. Relevant guidelines. The National Institute on Aging suggests that promoting independence in activities of daily living is key to maintaining dignity in patients with dementia. What are the ethical considerations a CNA must keep in mind when dealing with patient confidentiality and privacy? Answer. Confidentiality and privacy are fundamental ethical principles that CNAs must uphold in their practice. Key considerations: HIPAA compliance. The Health Insurance Portability and Accountability Act (HIPAA) mandates that patient information must be kept confidential and only shared with authorized personnel. Informed consent. Ensure that patients are informed about how their information will be used and give consent before sharing it. Secure record keeping. Maintain patient records in a secure environment, whether electronic or paper, to prevent unauthorized access. Discussing information. Avoid discussing patient information in public areas or with individuals not involved in the patient's care. Relevant guidelines. The American Nurses Association on a Code of Ethics emphasizes the importance of protecting patient privacy and confidentiality as a core aspect of nursing practice. In the context of patient care, how can CNAs assist in managing conflict or aggression from patients effectively? Answer. Managing conflict or aggression in patient care requires the CNA to be skilled in communication and crisis intervention. Effective management techniques. De-escalation techniques. Utilize verbal de-escalation techniques such as maintaining a calm tone, allowing the patient to express their frustrations, and using non-threatening body language. Active listening. Show genuine concern for the patient's feelings and needs, which can help diffuse anger. Setting boundaries. Clearly communicate acceptable behavior and set boundaries while remaining respectful. Safe environment. Ensure that the physical environment is safe for both the patient and staff, reducing factors that may contribute to aggression, e.g., overcrowding, noise. Involve team members. If aggression escalates, call for assistance from other staff members or supervisors to ensure safety. How should a nursing assistant approach self-care to manage stress effectively in a demanding healthcare environment? Answer: Healthcare is crucial for nursing assistants to manage stress and maintain their well-being while providing patient care. Key self-care strategies: mindfulness and relaxation. Engage in mindfulness practices such as meditation or deep breathing exercises to manage stress levels. Physical activity: incorporate regular physical exercise into daily routines to improve mood and reduce stress. Peer support: seek support from colleagues by discussing challenges and sharing coping strategies in a supportive environment. Healthy boundaries: learn to set boundaries between work and personal life to prevent burnout. Professional resources: utilize available resources such as employee assistance programs, EAP for counseling and support. Relevant guidelines: the American Psychological Association emphasizes the importance of self-care practices in reducing stress and improving mental health for healthcare professionals. What are the key strategies a CNA can implement to prevent falls in a healthcare setting, and what role does the environment play in fall prevention? Answer: to prevent falls, a CNA can employ several key strategies. Patient assessment: regularly assess patients for their fall risk using standardized tools, e.g. Morse fall scale. Factors such as age, mobility, medications, and cognitive function should be considered. Environmental modifications: ensure that the patient's environment is safe. Remove clutter and obstacles from pathways. Ensure proper lighting and visibility. Use non-slip mats and ensure that floors are dry. Ensure furniture is stable and accessible. Assistive devices: utilize assistive devices like walkers, canes, or grab bars. Educate patients on how to properly use these devices. Education and communication: inform patients about fall risks and encourage them to ask for assistance. Communicate any identified fall risks to the healthcare team. Monitoring and supervision: increase supervision of high-risk patients, especially those with a history of falls or cognitive impairment. Regular rounds: perform frequent rounds to check on patients and assist them as needed. The environment plays a critical role in fall prevention. By ensuring a safe physical environment, CNs can significantly reduce the likelihood of falls. Environmental risk assessments should be conducted regularly to identify and mitigate potential hazards. What are the appropriate steps a CNA should take when responding to a patient who is experiencing a seizure? Answer: when responding to a seizure, a CNA should follow these steps. Stay calm. It is essential to remain calm to effectively assist the patient. Protect the patient. Move any nearby objects that could cause injury. Place the patient on a flat surface and gently turn them onto their side to maintain an open airway. Monitor duration. Time the seizure duration. If it lasts longer than 5 minutes, or if the patient has multiple seizures in succession, call for emergency assistance. Do not restrain. Never try to hold the patient down or restrain their movements. Avoid inserting objects. Do not place anything in the patient's mouth, as this can cause choking or dental injury. Post-seizure care. After the seizure ends, monitor the patient for responsiveness and provide comfort. Assess the patient for any injuries that may have occurred during the seizure. Notify medical personnel. Document the event and inform the supervising nurse or medical personnel about the seizure occurrence. A fire alarm goes off in a healthcare facility. What should a CNA do to ensure patient safety, and what are the steps for effective evacuation? Answer: in the event of a fire alarm, a CNA should follow these steps to ensure patient safety and effective evacuation. Remain calm. Stay composed to reassure patients and prevent panic. Assess the situation. Quickly determine the source of the fire if safe to do so. If the fire is small and contained, attempt to use a fire extinguisher following the PASS method. Pull, aim, squeeze, sweep. However, if the fire is large or spreading, prioritize evacuation. Alert others. Notify staff members and call emergency services if needed. Evacuation plan. Follow the facility's evacuation protocols. Use designated evacuation routes. Assist patients with mobility issues by using wheelchairs or stretchers as necessary. Ensure patients are accounted for at a designated meeting point. Close doors. Close doors behind you to contain the fire and prevent smoke from spreading. Avoid elevators. Use stairs instead of elevators during a fire evacuation. Follow up after evacuating. Report to the designated meeting point and assist in ensuring that all patients are safe. Mr. Thompson is a CNA working in a long-term care facility. During a sudden natural disaster, he is responsible for the evacuation of residents. What key actions should he take to ensure a safe and organized evacuation? Answer: during a natural disaster, Mr. Thompson should take the following key actions to ensure a safe and organized evacuation. Activate emergency plan. Initiate the facility's disaster preparedness plan, which includes clearly defined roles and responsibilities. Assess patient needs, identify residents requiring assistance, including those with mobility issues, cognitive impairments, or medical needs. Gather supplies, collect essential supplies such as medications, medical records, and personal items for the residents being evacuated. Communication. Use clear communication to inform staff and residents about the evacuation process. Utilize PA systems or other communication tools as necessary. Assign roles. Delegate specific tasks to other staff members, such as monitoring resident conditions, helping with mobility, and directing others. Evacuate methodically. Begin evacuating residents in a calm and orderly fashion, prioritizing those who need immediate assistance. Follow evacuation routes. Utilize established evacuation routes and avoid hazardous areas. Account for all residents. After reaching the evacuation site, conduct a head count to ensure all residents are accounted for. Provide support. Offer emotional support and comfort to residents during the evacuation process, as this can be a stressful situation. By taking these actions, Mr. Thompson can ensure a well-coordinated and efficient evacuation, prioritizing the safety and well-being of all residents. What are the essential guidelines a CNA must follow when handling hazardous materials in a healthcare setting? Answer: when handling hazardous materials, a CNA must adhere to the following essential guidelines. Know the hazards. Familiarize yourself with the Material Safety Data Sheet (MSDS). For each hazardous material used in the facility, use personal protective equipment (PPE). Always wear appropriate PPE, such as gloves, masks, gowns, and eye protection when handling hazardous materials. Proper storage. Store hazardous materials in designated areas that are well ventilated and away from incompatible substances. Ensure that containers are labeled clearly. Safe handling techniques. Follow proper procedures for pouring, mixing, or transferring hazardous materials to prevent spills or splashes. Incident reporting. Immediately report any spills or exposures to a supervisor and follow the facility's protocols for decontamination and cleanup. Training. Participate in regular training sessions on handling hazardous materials and the use of PPE. Emergency procedures. Be familiar with emergency procedures, including evacuation routes and first aid measures in case of exposure. Describe the process and importance of conducting an environmental risk assessment in a healthcare setting. What factors should be evaluated? Answer: conducting an environmental risk assessment is vital for maintaining a safe healthcare setting. The process involves identifying hazards. Begin by identifying potential hazards in the environment, including physical, chemical, biological, and ergonomic risks. Evaluating exposure. Assess the likelihood of exposure for patients, staff, and visitors. Consider factors such as frequency of exposure, duration, and the vulnerability of individuals. Assessing consequences. Analyze the potential health effects associated with each hazard. This includes acute and chronic effects that may result from exposure. Implementing controls. Develop and implement control measures to mitigate identified risks. This may include environmental modifications, personal protective equipment, and administrative changes. Factors to evaluate during the assessment include condition of physical spaces, e.g., cleanliness, maintenance, availability, and use of safety equipment, e.g., fire alarms, emergency exits, employee training on safety protocols, policies for managing hazardous substances and waste. What is the protocol for reporting workplace injuries in a healthcare facility, and why is it critical for patient and employee safety? Answer: the protocol for reporting workplace injuries in a healthcare facility typically includes the following steps. Immediate response. Ensure that the injured person receives prompt medical attention if necessary. For minor injuries, first aid may be provided on site. Report the injury. Notify a supervisor or designated safety officer about the injury as soon as possible. This ensures that proper procedures are followed. Complete an incident report. Fill out an incident report detailing the circumstances of the injury, including date and time of the incident, location of the injury, a description of what happened, witnesses to the event, follow-up. Ensure that follow-up actions are taken, which may include a review of safety protocols and implementation of measures to prevent recurrence. Record keeping. Maintain accurate records of all workplace injuries, as this is essential for compliance with Occupational Safety and Health Administration (OSHA) guidelines. Reporting workplace injuries is critical for several reasons. It helps identify trends or recurring issues that need to be addressed to enhance safety. It ensures that employees receive appropriate support and compensation. It is essential for legal compliance and protecting the organization from liability. By following these protocols, healthcare facilities can improve safety and prevent future incidents. Explain the role of alarms and safety devices in a healthcare facility. What are the key considerations for their effective use? Answer: Alarms and safety devices play a crucial role in ensuring patient safety in healthcare facilities. Their roles include alerts and notifications. Alarms are designed to alert staff to potential emergencies such as patient falls, cardiac events, or environmental hazards. They provide critical real-time information that can save lives. Preventative measures. Safety devices such as bed alarms or door alarms help prevent accidents and alert staff to unsafe situations before they escalate. Monitoring systems. Advanced monitoring systems track patient vitals and can trigger alarms if values fall outside normal ranges. This allows for immediate medical intervention. Key considerations for the effective use of alarms and safety devices include proper training. Staff must be trained on the correct use of alarms and devices, including troubleshooting and response protocols. Regular maintenance. Conduct routine checks and maintenance on alarms and devices to ensure they are functioning correctly. Response protocols. Establish clear protocols for responding to alarms to avoid alarm fatigue and ensure prompt action. Customization. Tailor alarm settings to individual patient needs to minimize false alarms while ensuring patient safety. By effectively utilizing alarms and safety devices, healthcare facilities can enhance safety and improve patient outcomes. What are the key signs and symptoms that a CNA should recognize in a patient experiencing a stroke or heart attack, and what immediate actions should be taken? Answer: recognizing the signs and symptoms of a stroke and a heart attack is crucial for timely intervention. Stroke, using the FAST acronym. F. Face drooping. One side of the face may droop or feel numb. Ask the patient to smile. Arm weakness. One arm may be weak or numb. Ask the patient to raise both arms. Speech difficulty. Speech may be slurred or strange. Ask the patient to repeat a simple phrase. Time to call 911. If any of these signs are present, call for emergency assistance immediately. Heart attack. Chest discomfort. May feel like pressure, squeezing, fullness, or pain in the center or left side of the chest. Shortness of breath. This may occur with or without chest discomfort. Other signs: pain or discomfort in one or both arms, the back, neck, jaw, or stomach. Nausea, lightheadedness, or cold sweats may also occur. Immediate actions. Call for help. If stroke or heart attack symptoms are recognized, call emergency services immediately. Stay with the patient. Provide reassurance and monitor their condition. Positioning. Keep the patient calm and comfortable. For stroke, if they are conscious, position them to facilitate breathing and reduce risk of aspiration. CPR if unresponsive. If the patient is unresponsive and not breathing, initiate CPR and use an automated external defibrillator (ED) if available. By recognizing these signs and taking immediate action, a CNA can significantly improve the chances of a positive outcome for the patient. Discuss the significance of OSHA guidelines in the workplace and how they apply to the daily responsibilities of a CNA. Answer: the Occupational Safety and Health Administration (OSHA) guidelines are critical for ensuring workplace safety and health. The significance of these guidelines in the workplace includes protection of workers. OSHA regulations are designed to protect employees from hazards that can cause injury or illness, creating a safer working environment. Standardization of safety protocols. OSHA provides standardized protocols and practices that healthcare facilities must follow to ensure compliance and safety. Reduction of workplace incidents. By adhering to OSHA guidelines, facilities can reduce the incidence of workplace injuries, thereby improving staff morale and productivity. For a CNA, OSHA guidelines apply to daily responsibilities in the following ways: training and compliance. CNAs must participate in OSHA training programs that cover safe work practices, equipment handling, and emergency procedures. Hazard communication. CNAs should be familiar with the chemical hazards present in their workplace and understand the importance of proper labeling and storage according to OSHA's hazard communication standard. Reporting procedures. CNAs are required to report any workplace hazards, injuries, or unsafe conditions to supervisors, which is essential for maintaining a safe environment. Infection control. Compliance with OSHA guidelines regarding infection control practices such as hand hygiene and the use of personal protective equipment (PPE) is crucial in healthcare settings. By understanding and implementing OSHA guidelines, CNAs contribute to a safer workplace for themselves and their patients, ultimately improving the quality of care provided.